So coming to question number 30, a 56-year-old female has been diagnosed with gallstones and is undergoing pre-anesthetic checkup. She has been a diabetic since last 15 years, but sugar levels are within the limits. Which category of physical status does she fit into? ASA 4, 3, 2 and 1. So for that, we again go to the American Society of Anesthetics classification. So for that, we have the ASA 1, which is for a normal healthy patient. The patient should be healthy, it should be non-smoking, or there should be no or minimal alcohol use. ASA second is a patient with a mild systemic disease. So mild disease only without substantive functional limitation or end organ involvement. Current smokers come into ASA 2, social alcohol drinkers come into ASA 2, even pregnant females come under ASA 2. Obesity, that is from BMI 30 to 40, comes under ASA 2. Well-controlled diabetes or hypertension, as we have seen in this case. So well-controlled diabetes and hypertension, well-controlled diabetes or hypertension comes under ASA 2. Now mild lung disease, so the answer is ASA 2. So this is ASA 2. Why? Because the patient is having diabetes, but it is within the limits. So it will be ASA 2. ASA 2 will be the correct answer. Now seeing other points into it. Mild lung disease, again ASA 2. CHF and IHA class 1. Mild cognitive dysfunction, isolated mild or moderate obstructive sleep apnea with compliance with CPAP as prescribed. Now ASA 3 are the one, a patient with severe systemic disease. So substantial functional limitations, one or more moderate to severe disease, COPD, moderate morbid obesity, active hepatitis, etc., etc., etc. Now coming to, so if the patient will be having the poorly controlled diabetes or hypertension with or without end organ dysfunction. So in this ASA 3, there will be poorly controlled DM2 or hypertension will come into ASA 3. Now ASA 4 will be the one, a patient with severe systemic disease that is a constant threat to life. For example, recent MI, recent stroke, recent TIA, recent CAT, ongoing cardiac ischemia, so they all are coming to ASA 4. ASA 5 is a moribund patient who is not expected to survive without the operation. So operation is required so that patient can survive. For example, ruptured abdominal or thoracic aneurysm, massive trauma, intracranial bleed with a mass effect, ischemic bowel in the face of significant cardiac pathology or multiple organ systemic dysfunction. Then ASA 6 is a declared brain dead patient whose organs are being removed for the donor purpose. Now, other than this, there is something important in this classification is that although pregnancy is not a disease, so ASA writes that pregnancy is not a disease, but the parturient physiological state is significantly altered from when the woman is not pregnant. Hence, the assignment of ASA PS2 is for women with uncomplicated pregnancy. So, if there is a woman with uncomplicated pregnancy will not come under ASA first, but will come under ASA second. Then there is addition of E. So E for emergency surgery. And what is emergency? Emergency is defined as an existing when delay in treatment of the patient would lead to significant increase in the threat to life or the body part. So this was about the question number 30. And the answer will be ASA 2 because the diabetes is within the limits, the sugar is within the normal limits, it is well controlled. So the answer will be ASA 2. Coming to 31st question, a 30-year-old RTA accident victim is being taken up for the emergency laparotomy for hemoperitoneum and suspected multi-organ trauma. Which one of the following will be an indication for performing damage control surgery? So we have done this. This is a repeat topic in the same paper. So damage control surgery, they are asking for the indication for the damage control surgery. We have done this in the same paper, that there are for the physiologically the indications are either there should be hemodynamic instability, and we have discussed that hemodynamic stability means the systolic blood pressure should be less than 90 mm of mercury, not 100 mm of mercury. So A is wrong. Then third, we have talked, second indication in the physiology was the lethal triad. So there should be lethal triad. What comes under lethal triad? Lethal triad first is acidosis. Acidosis. But what is acidosis? Acidosis with pH less than 7.32? No. The pH should be less than 7.2. So in the lethal triad, the acidosis means the pH should be less than 7.2, not the 7.32. So B is again wrong. Second component of lethal triad is hypothermia. Hypothermia. And so they are writing that hypothermia less than 36 degrees Celsius. No. Hypothermia in the lethal triad means temperature should be less than 34 degrees Celsius. So C is again wrong. The third component is coagulopathy. So lethal triad third component is coagulopathy. So D is the correct option. So the correct option will be D, coagulopathy. Now coming to the another question, 32nd. That consider the following: pain relief, prevention of infection, anesthesia, and restoration of anatomy. Which of the features given above are benefits of fracture treatment? So the benefits of fracture treatment. So when you treat a fracture, what all benefits will be derived? So first is pain relief. Yes, there will be pain relief. Second, there will be prevention of infection. Yes, infection will be prevented. Third is anesthesia. No, anesthesia is not benefit, but rather because of anesthesia given during fracture benefit, there can be risks. So anesthesia is not benefit, anesthesia can create risk. Then restoration of anatomy, yes, this is correct. So first, second and fourth is correct. So C was the correct answer as given in the key also. So this was taken from the Bailey's table. So let us read the reference. So table 29.4, risks and benefit of the fracture treatment. So there were benefits and there were risks. So benefit was pain relief, prevention of infection, restoration of anatomy. So these were given in the options. Then early movement of the limb, early movement of the patient, improved function, reduced risk of secondary arthritis, and then financial cost, that is time off work. Then the risks was first because of anesthesia. So the anesthesia you provide can create risks, can create problems. So the risks because of anesthesia. So that was one of the option. Then introduction of infection can occur because of the surgery. Then damage to soft tissues and neurovascular structures can occur during the treatment of fracture. Then devitalizing of the bone can occur, for example like stripping of the periosteum, or because of the removal of the soft tissue around the fracture bone. So there can be decrease in the blood supply of the bone, and that's why there can be devitalization of the bone. Then the need for the implant removal is another risk, and then financial cost, for example cost of treatment, is the risk factor. So the anesthesia is not a benefit, it is a risk. Now coming to another question, question number 33. So a 30-year-old motorbike rider is brought to the emergency with history of road traffic and so RTA and altered consciousness. On secondary survey, the doctor notices presence of a bruise over the left mastoid process. So there is a bruise over the left mastoid process. The finding indicates fracture of mastoid process, injury to external auditory meatus, fracture of the skull base, or soft tissue injury to the neck. So this was asked from the figure of the Bailey, in which it writes that there is a bruise over the mastoid area. So this is known as the Bettel's sign. So this is known as the Bettel's sign. Bettel's sign. So it writes as skull base fracture may be associated with the bruising over the mastoid process. So the answer will be the fracture of the skull base. This is the fracture of the skull base, and the bruise over the left mastoid process is known as the Bettel's sign. Bettel's sign. So see, this was the 33rd. Now coming to the 34th question about the spine fracture. So it asks that what the hangman fracture. What the hangman fractures is a traumatic spondylolisthesis of atlas vertebra C1, traumatic spondylosis of axis of vertebra C2, or traumatic of thoracic vertebra T1 or L1. So what is hangman's fracture? So hangman's fracture is the traumatic spondylosis of the axis of the vertebra C2. So C2 will be the hangman's fracture. Now why is it known as the hangman's fracture? Because historically it was seen in the judicial hanging. So historically it was seen in judicial hanging when there was the hyperextension injury. Hyperextension injury. But This is not exclusively seen in judicial hanging. This can be seen in road traffic accident, diving injuries, falls. So B is the correct answer. When there is option number A, C1, so C1 is atlas, C2 is axis. So C1 is known as the Jefferson's fracture. So the C1's fracture is known as the Jefferson fracture. But this is not spondylolisthesis. This is the burst fracture. So this is the burst fracture of the atlas C1 due to axial loading. So C1's fracture is Jefferson fracture. Then we have another fracture of the C2, which is known as the odontoid fracture. So the C2's another fracture which is important is odontoid fracture. But in odontoid fracture, there is a fracture of the dens of C2. Dens of C2. While in the case of the hangman's fracture, the C2, the involvement is of the pars inter articularis. That is neural arc. So we have to remember three things: that the C1's fracture is known as the Jefferson fracture. C2, there could be hangman fracture, or there can be odontoid fracture. Hangman fracture is when the pars interarticularis is involved. Odontoid fracture is when the dens is involved.